90, I'm going to first check the physician's orders. I'm going to put a patient on oxygen today because their SpO2 is at 90 and they're having a little bit of trouble breathing. So her name is Miss Clark, and I'm going to grab my materials to do so. I'm going to grab my pulse ox and my nasal cannula. Okay. Hi, Miss Clark. I'm Cindy from Respiratory. I'm washing my hands today. I get 3 milliliters of alcohol-based hand sanitizer. I'm going to rub my hands for 15 seconds. And then I'm going to put some gloves on.
Go.
All right, first I'm going to identify you. Can you please tell me your name and your date of birth while I check it here on your bracelet? Okay, Miss Clark, July 8, 1990. I'm first going to get started with a few vital signs here. I'm going to use my pulse oximeter to check your saturation of oxygen, and I'm going to manually check your pulse for 1 minute. While I'm checking her pulse, I'm going to be checking her respirations also for 1 minute. Her SpO2 is at 90% as of right now. Her pulse is at 88, and her respirations are at 20, which are at the top of our range. And
Go.
I did not tell my patient that I checked his respirations because it would change his rate of breathing. Next, I'm going to set up his...
Go.
While I was taking the patient's respirations, I did not tell them that I was doing so because it would change the rate of breathing. My next step is going to be administering the oxygen through the nasal cannula. All right, Mr. Clark, I'm going to set you up with some oxygen here. Is that okay? Any questions or concerns while I'm doing this? Just let me know. All right, I'm going to attach it to the wall unit. I'm going to check for any kinks or make sure that there's air coming out this way. All right, Mr. Clark. In your nose, you're going to feel some air. It's going to go snugly around your ears and up to your chin. Does that feel comfortable? The patient says yes. So let me know if you're comfortable. If it starts getting dry, I can add some humidity with a bubble humidifier. We normally do this at about 4 liters per minute. And
Go.
next, it's been a little bit, so I'm going to do some follow-up vitals. I'm going to grab my pulse ox, and I'm going to figure out his SpO2 and his pulse. Also respirations, but again, I'm not going to tell him because it'll change the rate of breathing. Okay, I'm just going to put this on your finger, and I'm going to take your pulse for 1 minute. Okay, it looks like the oxygen is doing what it's supposed to. Your SpO2, your oxygen level is up to about 98 now, so that's perfect. That's great. And your respirations are back to normal, and your pulse is awesome as well.
Go. Go.
Now that I finished my vitals, I'm going to re-sanitize my hands. The gloves off first. Those 3 milliliters of alcohol-based solution for 15 seconds. And then I'm going to chart my information.
Go.
All right, so now that I'm charting everything that happened, his SpO2 went up after getting the oxygen, respirations went down, level of dyspnea before was high, now it's low. His color has been good the whole time, and now I'm going to go let the physician know. Okay, I'm going to administer the oxygen now to the Christmas tree. The doctor ordered 3 liters of oxygen, which is at a 32% FiO2. Okay, so some indications for this procedure was the fact that the patient was experiencing dyspnea, shortness of breath. Other clinical indications for oxygen therapy could be having trouble breathing, just like our patient. They could be having a trauma. They could be post-op. Like a complication with a COPD patient, they could lose their hypoxic drive with increased amount of oxygen, so they would just stop breathing altogether. The difference between a low flow cannula, nasal cannula, and a high flow nasal cannula is that low flow is less accurate, but it is more comfortable for the patient, and high flow is more accurate, but it's less comfortable for the patient. All right, so FiO2, how we find that out is 1 liter is 24%, and we go up about 4 from there. So 2 liters is 28%, 3 liters is 32%, 4 liters is 36%, and 5 is 40%, and 6 is 44% FiO2.